Welcome to all the students from B.R. Ambedkar Open University, Department of Social Sciences, Psychology. Today, we are going to discuss about depressive disorders and its symptoms, its causes and the better treatment. So, first let us understand what is depression. Depression is a mood disorder. Under mood disorders, depression and bipolar, two types of disorders are there. But in this, today in our class, I will lecture about depression. So, depression means it causes persistently low feeling and low energy, lack of interest. Persons will have in the depression conditions, and it can also have some symptoms like difficulty in thinking, difficulty in memory, and eating will come down or eating will sometimes increase, and sleeping patterns will alter. It is very normal to feel sad in our real life also. When we have some bereavement or death of a loved one, we feel sad, but it won't last more days. But depression is different. It is a persistent. At least most of the day, people are having very low mood, low feeling, and involves the sadness also. It is a psychiatric complaint. Depression is a psychiatric complaint. This depression is not common for all the people. It varies from person to person. And depression is having different severities also. Some people will have very mild depression, some people will have severe depression. And in time also, depression for some people is acute, for some people it is chronic. So, if we don't treat this depressive symptoms, it becomes a very chronic issue and which will affect our daily functioning. So, the typical age for having depression is normally 20s, even it may occur in any age also. So, how to identify a depressive conditions? So, there are some signs and symptoms available to observe the person is having depression or not. The depressive person continuously feel very sad and he loses his hope also, and he worrying continuously without proper cause. Children also will have depressive symptoms, not only adults, but children mostly will have, because of depression, irritability is more among the children. The depressive people will not enjoy what we are enjoying daily things, and some people eat very little during depressive conditions. Some people will eat more also to reduce their depressive symptoms. Because of this, people will gain weight. Because of low intake, some people will lose weight also. And they feel anhedonia. Anhedonia means feeling very low energy, depressive people. And they are very fatigue also. And they have insomnia symptoms like trouble in sleeping. And some people will have hypersomnia, means it is oversleeping. That means extra sleeping also. Continuously they are in sleep. And during depression periods, people cannot concentrate. When we don't concentrate, we cannot take proper decisions also. The depressive people, they very easily irritate and frustrate also. Experiencing physical issues like headache, stomachache are very common in depressive peoples. Finally, depression, if they don't treat in time, it leads to self-harm or suicidal tendencies. So, in depressive, there are different types. There are different types of depressions. We cannot see depression means only one way, one type of symptoms. And all these symptoms also people will not have. The first type of depression is major depression. Major depression, as per DSM, because DSM has given a criteria to identify the depressions. A person is having continuously 2 months this type of what we discussed, the symptoms: low feeling, low energy, less sleep or more sleep, low eating or higher eating. This type of symptoms continues more than 2 months will be called as major depression disorder. And the second condition is persistent. In earlier condition, it is only having a limited period of 2 months for observation, for identification and for diagnosing the person is having major depressive condition. Now, in the second type of depression, it is a persistent. Another name for this is dysthymia. In persistent depressive disorder, it will have continuously for 2 years and more also the depressive symptoms. So, if the condition continues for more than 2 years, it will be called persistent depressive conditions. And the third depressive disorder is premenstrual disorder. This will be called premenstrual dysphoric disorder, particularly for women during their menses cycle. Before onset of menses, a week before or 5 or 4 days before, they develop this type of depressive symptoms. After completion of their cycle, this will become slowly normal. So, this will be called premenstrual dysphoric disorder. And the fourth one, postpartum depression. So, during pregnancy period, after childbirth also, some women affected with this type of depression. This will be called postpartum depression. So, normally not for all the people, for some pregnant women will face this type of depression conditions. And another, depressive symptom is seasonal affective disorder, because we are coming across with different seasons throughout the year. But in seasonal depressive disorder, our moods will affect because of different seasons we are coming across. So, normally in winter season, the depression will somewhat more comparatively in other seasons, because in the entire world the sunlight is not common, the sunlight is not uniform. In certain places the sunlight period is very low. So, because of this prolonged, they are away from the sunlight, they become depressive. So, this is called seasonal. So, because of this people are becoming depressive, it is called seasonal affective disorder. So, we will discuss now about the depression, why it is coming, on what causes people are becoming depressed. The first cause is brain chemistry. In the brain, we have different types of neurotransmitters like serotonin, dopamine. So, these imbalance, particularly serotonin and dopamine imbalances, will alter the brain chemistry. Because of this alteration in brain chemistry also, people will have depressive symptoms. And the other cause is genetics. See, we are all genetically loaded. Suppose if anybody in a family having already genetically they are depressed, they are having more depressive symptoms, means there are more chances the persons, their family members getting depressive symptoms is very common. Even see, without a family member who is having a depressive symptom, also there is a chance as a first generation member also becoming a depressive person. And third one, and very important cause, and present society is having this type of biggest problem, stressful life conditions. Everybody is having some stress, but people don't know how to cope from their stressful conditions. Without coping mechanism about stressful life incidents, people becoming stressed. So, stress becoming because of unsolved problems, it is they are becoming depressed, they are becoming very low feeling, very unsatisfied people, continuing with low mood. Normally, stressful conditions in the life means failure in examination, losing a job, financial loss, and divorce in family. All these conditions are very stressful to the people. So, because of continuously thinking all these conditions, people are becoming depressed. So, stressful life events making people very much depressive and is leading to very serious complications. And the last cause is medical conditions. Suppose some people are having chronic pain, a cancerous patients particularly, because of chemotherapy and the expected outcome of their condition, they fall into depressions. And some medications also will have side effects and they create this depressive symptoms. How these depression conditions are identified by professionals. So, before treatment, we have to identify properly the symptoms, the depressive conditions, really the person is having depression or some other conditions, or it was misdiagnosed by the persons, those who are suffering, they are thinking simply it is depression. So, professionals has to diagnose properly about the symptoms. So, healthcare providers, particularly when they come to a client, they will review their medical conditions, medical history and family history and present lifestyle. All these things, by observing, they will come to some understanding whether the person is having, at what level he is having depressions. And psychological tests also available to confirm the depression. The famous psychologist Aaron Beck has developed one test, Beck Depression Inventory. By conducting this test, we can find out the person's severity of the depression. See, depression, there are different conditions, different severity levels. Mild depression, some people will have some moderate level, some people will have very severe level, but all are depressions. But by conducting some psychological test like Beck Depression Inventory, we can find out the level of depression, the intensity of the depression. So, if the depression level is so intense, so pharmacology treatment is required. If the depression is very mild, then we can reduce the depressive symptoms with some therapy models. How to manage? Management and treatment of depression. So, there are various approaches for managing depression. First, we have to understand the person's thought process, because thought process only creating many problems. If the person is thinking very negatively, he is believing all the negative thoughts, means his suffering will develop. So, the professional will interact during his interview, he will find out how his thought process, his thoughts are giving any effect on his emotional aspect. Because of these emotions, he is undergoing the depressive symptoms. So, finding out the thought process, thinking process, and how these thoughts are creating effect on the emotions is very, very important in finding the solutions for depressive symptoms. And in the treatment process, there are different methods. Suppose if the brain abnormality has come out, because of this brain abnormality can be found out through tests, medical tests. If the brain abnormality means through medications only, they will treat this, particularly this type of depressions. If the depression is causing because of distorted thought process, that means wrongly understanding the situations and without knowing proper coping systems for that particular problems. So, therapist will try to guide the person properly to understand the wrong way of thoughts, the distorted thought process, and he will guide the client to restructure his thought process. By restructuring his thoughts, definitely his self realization he develops, like that his understanding will improve, slowly his depressive symptoms will reduce. So, what type of therapies are available? First come to therapies, next medication. Okay. The first therapy is cognitive behavior therapy. This cognitive behavior therapy was invented by Aaron Beck. Cognitive behavior therapy. Suppose the depression is a present behavior of the person. We cannot change the behavior directly just by asking the person, change your behavior. To change the behavior, for this particular behavior, there are some hidden causes are there. That causes we have to find out. The hidden causes are called his cognitions, his thought process. So, until unless we change the thoughts, his feeling cannot change, his behavior cannot change. So, in cognitive behavioral therapy, by identifying the maladaptive thoughts, by identifying the ill thoughts and correcting those ill thoughts, then only his behavior will change. So, that is the reason it was named as cognitive behavior therapy. So, this is very important therapy. Entire present world is following this cognitive therapy. Under the cognitive behavior therapy, it is a spectrum, it is an umbrella term. Under this umbrella term, many new psychological therapies has come into picture. CBT, that means cognitive behavior therapy, is the main therapy. It is a head of the family. Under this umbrella only, many new therapies has come to solve these psychological issues. Like that, the famous second therapy is dialectical behavior therapy, DBT. It was developed by Marsha Linehan. Dialectical, because normally people think in two ways, in two extremes, either this way or that way. Nobody thinks about the middle way. So, this dialectical therapy will provide some solutions to reduce the depressive symptoms. Particularly, the aim of dialectical behavior therapy is teaching some skills to the suffering person, because the suffering person lifelong he cannot approach a professional or therapist. He himself learn certain type of skills, how to face certain situations, how to cope from the presenting problems. So, ultimately, by learning those skills, he himself become like a therapist. He himself solve all his problems. So, in this there are 4 types of techniques are available in dialectical behavior therapy. How to regulate the emotions, because thoughts creating some emotions, but uncontrollable emotions is only creating problems. That means people are unable to regulate their emotions. Some people are very angry, some people are very sad, irrespective of the situation. According to situation, if the emotion prevails, there won't be much problem. But people are unable to regulate their emotions. Because of unregulation of emotions, they are facing problems. So, in this therapy, the skill, it will teach us how to regulate the human emotions, and second skill it will teach is interpersonal development. When we are dealing with other people, how to interact with them. Some people, they are in poor. So, interpersonal relations also will cause some distress in our day to day living. So, how to make interpersonal relations also is a skill. So, ultimately this dialectical behavior therapy teaches different types of skills, how to overcome the present situations. And the other thing is, in this DBT therapy, mindfulness practicing. Mindfulness, it is a deep type of meditation. Mindfulness means nothing but being in the present, because people always, they are in the past or they are in the future. Past is always painful. Past cannot be changed. Happened is happened. Future we cannot predict. Future is always anxious. So, this therapy will teach to the suffering people, be in the present through mindfulness. So many thoughts is entering into our mind, but if you give importance to every thought, definitely people will suffer. So, thoughts are simply coming and going. So, which thought we have to give important is more important. So, this therapy will teach the mindfulness practice, and particularly which thoughts we have to give important, it will teach. And the third therapy, these are all called new generational therapies, DBT, and this acceptance and commitment therapy. The third one is, normally people are not in accepting mode is always good, but we always not accept many things. Unacceptance, that means the rigidness, will create lot of disturbances in our thinking process. So, psychologically we should have flexibility. So, this therapy, particularly this acceptance and commitment therapy, will teach us how to reduce your inflexibility, how to improve your flexibility levels. When we are flexible, definitely many problems will come down. So, this acceptance and commitment therapy is very, very important therapy to reduce the depressive symptoms. And other effective techniques are available, not only therapies, there are other techniques are available to reduce and to heal from depressive symptoms. One is behavioral activation. Normally, depressive people are more isolated. They don't talk to people, most of the time they spend time aloof. So, behavioral activation means everybody will have some interested activities. Those interested activities we have to identify. See, I have some 10 activities. In those 10 activities, which are the more happiest things for me? Those activities I have to practice. I want to meet my friend, I want to spend some time, or I want to take some support some of my friend, I want to play something. See, certain interested things we have to identify, those areas we have to implement. So, this is called behavioral activation. this is the best one available in present societies, because medications will have always some side effects, and this behavioral activities means changing people's attitude and activities. And another technique, effective technique, is problem solving. Okay, some problem has come, some relationship problem has come. Normally in relations, what they do, once any problem comes, they move away. They don't talk each other. See, without talking, how the problem will get solved? So, problem solving technique is very, very important. Communication they have to improve. Without communication, problems cannot be solved. So, this is also a very good technique. And the third one is the person's mood monitoring. See, always in 24 hours we are not in same type of emotion or feeling. So, whenever a person mood is getting disturbed, we have to journal it, we have to write because of which thought process we are getting disturbed. So, by writing which are the triggers a person is getting disturbed, identifying those triggers and solving those triggers definitely will reduce the problems. And another skill is goal setting. So, which is possible, that goal only we have to maintain. But nowadays you are all seeing, particularly in intermediate education, some students are dying because their goal is very high, but everybody cannot achieve those goals, which is possible as per our ability. Goal setting is important. See, our ability is at lower level, our goal is very high, but achieving is somewhat difficult, no? So, this is creating ultimately problematic situations. That is the reason some students are dying nowadays, because their goal is very higher, but their abilities are not matching to their goals. And cognitive restructuring is another technique, because we are having a rigid thought process. I want to achieve compulsory, I must do it, I must pass. How it is possible? Sometimes definitely we will encounter some adverse situations. So, we have to restructure this type of I must pass, I should get it done, this type of thing we have to restructure to reduce the rigidity thinking. And the final one is relaxation technique. There is a famous relaxation technique, JPMR, Jacobson Progressive Muscle Relaxation Technique. So, other than these therapies, some other options are medication. So, with biological treatment, we can improve these depressive symptoms, and complementary medicine is also available, like body massage, acupuncture and yoga practicing regularly. And there is another therapy, brain stimulation therapy, that is electric shock giving to the people to control these depressive symptoms. And people advising regularly doing physical exercise and making quality sleep and eating healthy diet, avoiding alcohol, spending time with supporting people will relieve the people from depressive symptoms. Thank you.